There's so much confusion out there about spinal decompression. I mean, seriously, you go online, you talk to people, and suddenly everyone's an expert except no one's saying the same thing. And when you're in pain, when you're desperate for answers, and it's so easy to fall for promises that sound too good to be true from a radio advert or something, or get completely freaked out by horror stories that probably don't even apply to your case. So let's just have a real conversation for a minute. No hype, no fear, just what's actually true. First of all, let's drop the idea that spinal decompression is some kind of miracle fix for every kind of back pain. I wish it were that simple, I really do, but it's not. Decompression works best when there's nerve compression involved. Like with herniated discs or spinal narrowing, it's a very specific tool for a very specific type of problem. It's not for muscle strain, it's not for inflammation or those generalized chronic pain issues. And no, those decompression tables are not the same as surgery. They can help create space and reduce pressure. Yes, but they can't remove bone spurs or do what a scalpel can. That doesn't mean they're useless. Far from it. We get phenomenal results, but only when the right person gets the right treatment. On the other hand, there's this weird belief that surgery should always be first, which is just not how modern spine care works. Most of the time, you start with conservative treatments, chiropractic, physio, medication, maybe even injections, and only if those don't help after a good 6 to 12 weeks, then surgery might be on the table unless something really serious is going on. And look, I get it. The idea of spine surgery is terrifying for a lot of people. And yeah, surgery comes with risks. It always does. Another thing people get wrong is expecting to feel better instantly after starting spinal decompression. Sometimes there's quick relief, especially with leg pain, but full recovery takes time. Nerves heal slowly, and some symptoms might linger for a while. And here's a big one. Not everyone is a good candidate for decompression. You need the right imaging, symptoms that line up, and you have to know what's realistic, your age, your health, even your mindset. It all matters. And just because one area gets better doesn't mean your whole spine is suddenly invincible. Issues can pop up later. That's just life and aging and movement. And one more thing, don't assume every specialist will say the same thing. They won't. Doctors have different training, different tools, different biases, and that's why second opinions can be so valuable. So if you're trying to figure this out, here's what you really need to remember. First, you've got to get an accurate diagnosis. Second, try conservative treatment first, unless it's urgent. Third, be realistic, know what to expect and how long it might take. Fourth, your case is yours, not your friends, not your coworkers. And fifth, this is long-term. You've got to take care of your spine with movement, strength, good habits. Spinal decompression can absolutely work. You know, our success rates are incredibly high with this treatment, but here's the kicker, that success really comes down to ensuring that the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. And this is huge. The practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world. And this is why I can't stress enough how important it is to find someone who's not just trained, but truly expert in this field. You want a practitioner who really understands spinal mechanics inside and out, because that expertise is what separates marginal outcomes from incredible ones.